Hi, today I'm going to be showing you how to make an ice bag. Ice bags are great for any acute injuries. So today our sample patient is a 25-year-old male coming in with a right ankle sprain. So he rolled his ankle playing basketball yesterday and there's some pain and inflammation. So we're going to choose to use an ice bag to treat him today. Some of the benefits of an ice bag are they are cheap, easy to make at home, and they're easily able to conform to different joints. Some of the things you do want to be mindful of are any sort of cold intolerance that your patient may have, something called cold urticaria, which the patient would present after treatment with any sort of red, raised, itchy bumps. So prior to treatment, you do want to kind of check a small area of the skin, make sure there are none of those effects. If there were, you would obviously cease treatment and remove the ice. Before treatment, as I mentioned, you do want to test that small area. You do want to inform the patient kind of what they are to expect. So they're first going to feel the cold sensation, and then they're going to feel an aching, burning eventually before it goes numb. That's kind of the normal process that they'll go through. So teaching them to make an ice bag. I have just a sample bag here filled with crushed ice. When they're making it at home, you want to fill it just kind of proportional to the area that you're treating, so you don't need that much ice for the ankle. It's not that large of a joint. For something like lower back or any other larger areas like the quad, you might get a little bit more ice, but just making sure all the air is removed from the bag. And then leaving a little bit of space just so you can form it, so tying the knot a little bit away from the top, but still so you can easily spread that ice around once that's sealed off. So I'm going to ask the patient to go ahead and lay on his back, and we're actually going to remove his sock here, and we're going to also elevate it with some pillows that should help with some of the inflammation. Just making sure they're comfortable. And he's going to have to remain in this position throughout treatment, so just something to note, you can't be doing any sort of active exercise while the ice is being applied. That would kind of decrease the efficiency of the modality. So you want to form this around his ankle. Again, you can kind of just test that small area, making sure you don't see any of those adverse effects. Once that's cleared, you can go ahead and apply that, kind of form it to the ankle. So this is crushed ice. Ice is most effective when it's going through a phase change, so melting from ice to water. Our target tissue temperature here is 55 degrees, and we're going to leave this on here for 20 minutes. You can go through cycles, 20 minutes on, 20 minutes off, just depending on how much time you have throughout the day, but try and do that for 3 times a day, as long as that pain and inflammation is present. And then once those 20 minutes are up, just removing the ice bag. You may note some areas of redness, and that's totally normal, so just letting the patient know what to expect post-treatment as well.